My name is Caesar Butura. I'm an oral maxillofacial surgeon in Phoenix, Arizona, and I'm also the ZAGA Center for the Southwest region of the United States. Today, we're just going to chat a little bit about what the differences are between a removable denture and a fixed bridge supported by dental implants. Often, when patients come to see me, they ask me, am I a candidate for implant treatment? And I'm happy to say that most of the time, actually almost all of the time, I'm able to say yes. Most of the folks I see have had either implants that have not done so well or have been without teeth for multiple years. These patients are usually in some type of removable denture. Unfortunately, removable dentures have not improved in the last, let's say, 50 years. However, we're able to offer implant based prostheses or bridges, which are different than removable dentures. And these allow folks to function just like they would do with their regular teeth. So the difference between a removable denture and an implant supported bridge or denture is very simple. One comes out, one stays in. With the one that comes out, you have difficulty eating, you have difficulty speaking. Also, what people don't realize, you lose a lot of your taste because the denture covers the roof of your mouth. With an implant supported bridge or denture, there is no roof of mouth, so your taste sensation comes back. You're able to eat almost every food you desire, and you no longer have to remove anything from your mouth. So that self-conscious feeling of my denture slipped, what do people think about me because I have a denture, or my face has aged over the years because I've lost also support from the teeth that I had and also the bone that has been lost over the years. So we can regain all that for the patient that comes in without teeth in the upper jaw. And a lot of times for these really challenging cases, we offer either zygomatic implants, pterygoid implants, or implants placed in the side of the nose. I know that sounds invasive and maybe a little far-fetched, but these treatments have been around for multiple years and are well proven to work both in the literature, meaning scientifically, and in just clinical practice. So people ask always, hey, is this going to hurt? How long is this going to take? How long do I have to take off work? Usually the procedure to place zygomatic implants, it's anywhere between an hour and a half to in most 2 hours. Recovery is 3 to 4 days, some swelling, and we always recommend some time off work. Also, another question that I'm always asked is, hey, how long has these have been around? It's something new. These have been proven in both the literature, and they're also approved by the FDA. So these implants work and they last. In the right hands, with the right skill set, these implants should last 10, 20, 30 years with of course, the proper care. The other question I'm always asked is, are these expensive? And I would say, define expense. So yes, the procedure is more expensive than a denture. However, the value that this adds to someone's life and the improvement that it adds to daily function, and most importantly, improvement to self-esteem, I think is well worth the expense that this procedure will add. Another question is, hey, am I someone that can benefit from this? And of course, the answer is always yes. Um, Maintenance always comes up, how difficult it is to maintain these type of fixed bridges. And really, I always say, if you can brush your teeth, if you can floss your teeth and use a water pick, you can maintain these particular bridges based on implants. The procedures have evolved. So implant procedures have evolved over the years. Um, when I started practicing as an oral surgeon, I hate to say about 30 years ago, patients that came to us with very atrophic maxillas, or basically upper jaws that didn't have enough bone for dental implants. We had various procedures to add bone from either the hip or cadaver bone or somewhere else in their mouth to add to the upper jaw. That produced 2 surgical sites. It made treatment very long, sometimes over a year. And frankly, the results weren't that great. As we became more advanced in placing implants in other parts of what we call the facial skeleton, The procedures became a lot less invasive because we did not have to add bone or recruit bone from other parts of the body to add to the upper jaw. So the technique now is usually perhaps 4 to 6 implants in the upper jaw. We started the procedure was initially named the all-on-4 because it was 4 implants per upper jaw, but sometimes from added support we add maybe 5 or even 6 implants to be able to deliver a bridge on those implants. What also folks don't, I want them to realize, patients that come in, is that usually 9.9 out of 10 times teeth are given the same day. So not only do you have implants placed without grafting, but the same day you'll have teeth that you can use right away. I mean, granted, there's some limitations till the surgical sites heal and the implants integrate, but you're going to be a lot better off than when you're with a denture. So I urge, if you have any issues with slipping dentures, failing teeth, or if dentists or doctors have told you there's no way to get implants in the upper jaw, we have ways to solve those issues. And it's usually with zygomatic implants, pterygoid implants, and implants usually placed somewhere in the lateral nasal wall. Often amassed, are 4 implants enough to restore the upper jaw that's been without teeth for multiple years? And I would say most of the time, 4 implants are enough. However, if the atrophy of the anatomy is so compromised, occasionally we have to put 6 implants. And the difference is, as you as a patient, you will not know the difference between 4 or 6 implants. You will still have teeth really the day of surgery. However, from the surgical standpoint, we have to look for another area or areas to add 5th and 6th implant. But at the end of the day, the result is the same. The patient leaves with teeth that were delivered that day.